Well, hello everyone. Hey, so I've been doing these videos now for a couple of months, and today we're going to do something a little bit different. We're actually going to take the show on the road. Tuesday, we have a couple of different classes going on at JLA Atascocita. At 11 o'clock, we're going to have Sally Redmond doing her 12-week year. It's great for planning and setting up your short-term and long-term goals. She does a fantastic job, and I hope to see everyone come participate with that class. Shortly after that, we're going to have my personal physician, Dr. Sean Weaver, who's over here in Kingwood. He's going to be coming in to talk to everybody about a new type of medical service that he is participating in. And for those of you that don't know about where Kim and I came from, for 20 years I worked for Fortune 100 companies with fantastic benefits and insurance. So when we both went full-time real estate, what a culture shock, right? Insurance is very, very expensive, and I don't feel like you get a whole lot of value for what you pay. But the downside is I think that a lot of agents and self-employed people just take a risk and don't do anything at all, or they purchase the minimal package and you still end up paying for everything. Well, Dr. Sean Weaver has joined a group of about 400 other physicians that believe that insurance in this world and in the United States is broken, and it's messing up the medical industry. So what he's done is he's doing something called DirectMD. I think it's fantastic so far. He's been my physician for about 5-6 years, and he's going to come in and talk about why he moved his entire family over to this model for healthcare and how it can benefit you and yours. So again, this is very important to me. I hope each and every one of you are able to participate and come to this on Tuesday from 11 to 12. But we are here in Kingwood, and we're actually going to go upstairs and we're going to interview Dr. Weaver just with a couple of questions so he can tell you personally why he feels so strongly about this new medical way of doing medicine. So anyways, let's go upstairs. Let's see what Sean has to say. Okay, everybody, so I came upstairs to Dr. Weaver's office, and I kind of took him away from his patient. No, I'm just kidding. He really wasn't seeing anyone just right now. This was a scheduled time, so I didn't intrude on him. But I thought it was important to let him tell you what you can expect a little bit of on Tuesday when he comes in to speak about his practice, as well as I thought it was pretty huge, the fact that he took this leap into this model and decided that it was the way that healthcare needed to go back to being simple. And I'm going to give him a little chance to explain what you can expect and why he chose to follow this model. So go ahead, Sean.
Well, yeah, I mean, this has been a long time coming. I've practiced in this area for, over a decade, and seeing each year things get worse, and it was driven by the insurance companies. It starts to become very frustrating, I think, for patients and for doctors. And I think you really start to see how broken our system is. And I just got to a point where I finally made that decision. And this was actually spurred by my own family's insurance that was so bad and kept getting worse that we started to investigate and try and figure out, is there something outside of the traditional insurance model? Well, there is. And I was surprised that you just don't really know about it. Well, we made that decision for our family to switch, and in the process I actually found this model, and it's called direct patient care, direct primary care. And when you look at it on paper, it really just starts to make sense because it's very simple, it's straightforward, and it's actually way more cost effective than our traditional system, which is nice. But on the flip side of it, what you get is so different than our traditional healthcare. You start to say, this is how healthcare should be. And this is the way it used to be years ago, where you had your family doctor, you could call them and they would come out to your house and they knew you. Well, we put technology to work with that to say, if you need to get a hold of me, you can do that. You can text me, you can call me, you can email me directly. I mean, there's no barriers.
I do have to say that I have been texting Dr. Weaver while he's at the gym. So, he's like, sorry, I'm in between reps, and so he is accessible, and I, the comparison between, I saw him when he was at Humble Family Practice, and I just had a scratch on my arm or something, and I remember walking in, and there must have been 20 doctors, and there must have been 30 nurses, and it was like a puppy mill. And I remember you were almost sweating coming from room to room.
It was.
And I mentioned to you, I said, man, this is horrible. And that's when you said, I hate it, And the difference between that visit, which we probably had 10, 15 minutes, compared to when I come in here into your office, we spend an hour discussing anything and everything that we need to discuss. I mean, everything that has to do with my health, we can do in one appointment, and not, oh, sorry, you have to set up another appointment. I can only do one thing at a time due to co-pays and things like that.
Yeah.
So, I just the comparison of the feeling you get between those two different visits is amazing. So.
Yeah, and again, that is driven by the insurance model, and you start to see that's the business side of medicine, where we now treat patients like numbers, where it's just about dollars and cents. And part of that is to say we got to see X number of patients to pay for overhead, and a lot of that overhead is because of insurance. Well, when you get that out of the picture, it becomes so much easier, where you say, if you want to come in here and talk for an hour, we have the liberty of doing that. Or if you say, hey, I'm busy, can I just call you and we figure out something over the phone, we can do that too.
Yeah, there's nothing beneficial for him to make you come into the office.
Yeah.
Because you pay a monthly amount, and that's based upon how much he can predict you're going to need his attention.
Right.
If someone's going to need his attention several times a month, of course your monthly fee is going to be a little bit higher. But if you're in pretty good shape, and decent health and mid age, I think I pay $79 a month. And there's no copay if I come in. Everything's kind of taken care of. When I need something, I just text him. He calls in a prescription. It's a pretty simple process. I don't have to come see him every time just to get, per se, blood pressure medicine. I don't have to do that every time. Whereas the other model, that's where they get their money. And the insurance forces you to have to see them. And that was all part of the negotiations with Obamacare, that, okay, we're going to force everyone to have this certain type of insurance. But for you, doctors, we're going to force them to come see you for every individual little thing. And now they have to pay a copay, and that's where you got your money from. So I think it's a cool model. Again, I'm a little passionate about this, and I would hope to see everyone on Tuesday from 11 to 12. Dr. Weaver will be there. We'll have some lunch afterwards. He'll be around for question and answers. It sounds too good to be true, I'm telling you, but after he explained it to me, I just came in his office. It's him, a nurse, and someone working the front desk. There's no need for a bunch of staff.
There isn't, and there really shouldn't be. I mean, if you need to get a hold of me, get access to me, that's what this model does. So really, it's very simple, it's affordable, it's straightforward, it's completely transparent, and that's the way it should work. I mean, it'd almost be like if you went over to HEB and a gallon of milk was $40, and you said, well, I'm not paying the bill, my insurance is, so I'll accept that. But then you go across the street to Kroger and the milk's $2 a gallon. Well, if you had that out in front of you, it would be a very simple decision to say, well, there's no way I'm paying $40 for that gallon of milk. Well, that's what healthcare does nowadays. So really, I mean, I'd be happy to show you the alternatives to the traditional insurance, where you can get coverage for big stuff at a very reasonable cost. And then paired with this direct primary care that covers almost all your day-to-day needs, those work very well together. And once you experience it and you see it's so much different than our traditional system, it's hard to go back into that system. And this really is what will force change in healthcare at a local level. And that's what we need in Houston, but also in the country. And I can show you this movement is going across the country. So there's lots of doctors that have seen this and are now doing this. So this is actually going to be the future that's going to make change in healthcare for our country.
Well, wonderful. Well, I tell you what, I hope that everyone's excited to hear about more of this on Tuesday. I'm sure there's, for all you moms out there that really stress out over these sorts of things, I'm sure you'll have plenty of questions. But he's there, and he's going to be accessible, and hopefully this works and brings some value to you and your family. So I'll be looking forward to seeing everybody on Tuesday.
Yep.
There you go. Thanks.